This is chapter 4 or third chapter of the 4 for the quiz next week. And we are talking about reversible cell injury. Hydropic swelling, cellular swelling, because the accumulations of water is the first manifestation. Yes, it's true. But don't remember, these particular slides, not all of them are coming in the quiz. I will take my time over here because I want to explain something, and then I will guide you in the ones that you need to know for the quiz, okay? Don't think that I will put the everything over here because impossible. They don't allow me to do all the questions that I want. Yes, but I have another Alejandra in another place. Alejandra. All right. Hydropic swelling, cellular swelling, because the accumulations of water. First manifestation of the most form of reversible cell injury result from the malfunctions of the famous sodium-potassium pump with accumulation of sodium ion within the cell. Now, in some classes, I made it to reach over here in the sense that I basically did this question: how a person die? If you remember, it's because the lack of production of that ATP. But who produced that ATP? The famous enzymes. And the enzymes are sensitive to the famous pH and temperature. In biology, they want to put something extra, but for me, in the clinical setting, this is the ones that we need to always pay attention. Now, if you remember something, well, I hope so, in the physiology class, every cell have a membrane. What happened with that membrane? That membrane is semi-fluid, correct? And a semi-fluid and have a huge component of what? Of cholesterol, because it's fat, basically fat, phospholipid bilayer, correct? And the reason for that is to keep everything that is out, and everything that is in, keep it in. But that layer of the cells, those membranes, are not perfect. Meaning, but believe it or not, there is always a leakage inside of the cell of sodium and a leakage of potassium outside. This is the way. This is the way, like Mandalorian will say. Meaning that the cells always need to keep the sodium out and the potassium in. And the first question, if somebody is following me in the night, exactly. Good, Gaston. You have the guide over there. The protein or the enzyme that keep this balance is what we call the sodium potassium pump. Sodium potassium pump is a protein. It's an enzyme that is encrusted in that membrane of the cell. And the work of this particular sodium potassium pump, that is a protein, is to keep the sodium outside and the potassium inside of the cell. Why is that? Because sodium have a positive charge and potassium also have a positive charge. The cells need somebody with a positive charge inside them. The problem of sodium is what? That if you have sodium inside of the cell, water will follow. And that is the reason that you have the swelling. And cellular swelling in another clinical setting is what we call edema. Okay? And that's the reason why the sodium potassium pump always works 24/7 to keep the constant expel of sodium out of the cell. Meaning, this is a protein that is always working, never stop 24/7. The only moment that this pump stop working is the day that you die, to make it clear. I will go a little bit beyond. From the 2,000 calories that a person will eat in one day, more than a half of the calories is to keep every potassium pump of every cell working at all times. Imagine how many sodium potassium pump we have in every cell, multiplied by trillions of cells that the human body possesses. Clear? But this is the initiation that will break the balance and the cell start to basically swell. And this is something that we basically recognize sometimes like a edema in some patients. I hope that at least that give you a little background. Now, let's go to the slide. This one is coming in the test. Yes, it's coming in the test. Somebody will see this one as a multiple choice. 1 of 4. Now, you have some characteristic. I will not go with characteristic. You need to remember, because this is something that always will hunting you out in the core, that something that increase in size is megally, became wide. But again, I will not ask you this one. Moving on to the next one. You will see that some cells have some accumulation. Sometimes could be something that the cell don't see like a problem, but in another cells, exactly that you see over there, can create toxicity. To give you an example, in the neurons that you have in your brain, any accumulations of the famous beta amyloid is very associated with Alzheimer's, meaning that sometimes we need to be extremely careful what happens inside of the cytoplasms of the cells and what they are accumulating over there. Exactly. But don't worry, I am crossing the finger. They are saying over there that there is a possibility that in the next few years we will have a vaccine against Alzheimer's. Yeah, I will be more than glad to prescribe that one as soon I have the opportunity. That is what they said behind doors, that they are almost there with that vaccine. I don't know if it will work for everybody. I don't know if it will be a way to stop the progress of the disease to the person that already have Alzheimer's. But let's see. I am crossing the finger that will be something fundamental in the next 5 to 10 years. Okay. Do I will ask you this one? No. But it's to give you an idea, a little bit of class also, because we didn't cover this chapter in the class about this particular intracellular accumulation. Sometimes the cell have viruses inside of them. Those viruses basically go like some kind of latent period over there. They don't move, they don't do anything, waiting for the best moment to attack. For example, just to tell you, I will go a little bit ahead. Anybody that have, for example, varicella or chickenpox, prepare yourself. You will have shingles at the end of your life. Why? Because it's the same kind of family of virus. Once that you have varicella or chickenpox, that virus never went away. It stays with you in your body, hiding. Oh my God, really, Ashley? Already shingles so young. Oh my God. Oh my God. Your immune system is bad then. No, just kidding. What you need to do, and I recommend, even that you already suffer shingles, look for the vaccine because at least when you have any kind of problem, at least the attack will be less every time that you suffer because the shingle always come back with a vengeance sometimes. But again, I will not ask you this one. Now, the intracellular accumulation you see over there, accumulation of normal substances, faulty metabolism, the pigment, accumulations of the excess amounts of normal intracellular substance. We have, for example, macrophages inside of our lungs that live with you for almost 10 years. Same cell, and because those cells basically are catching any debris that are coming inside so the alveoli, they start to accumulate a lot smoke, a lot of debris, a lot of things. And when they do a biopsy, it's very interesting to see these macrophages full of crap or so many things that they catch with the pass of time. Again, I will not ask you this one. We have accumulation also in the liver. And sometimes chaperone proteins that will help you out to fight this particular alteration that the cell possesses. But again, because this is the first chapter, we will go through this one again, and that's why I ask you this one in the quiz. Now, what you need to pay attention is the cellular adaptation. What is atrophy? You need to know that. VIP. Not only you need to know that definition, you need to recognize what is an atrophy when you see it. Meaning, in this quiz, in the 4 quizzes, you have pictures of different problems in the muscle and other parts of the body, and you need to identify is this atrophic, hypertrophic, is this hyperplasia. And don't worry, don't freak out, because in this particular set of PowerPoint, I will show you what are the pictures that you need to pay attention in case that you see one over there. But right now, VIP, I will ask you for this one. And I will include with that fee the following slide. Careful with this one because it's the general causes over there. There is a question in the quiz. There is a tiny medical case. It's an old question. I always say it because it's older question. I like to put it over there to see how the people analyze the question. And basically, it's a football player. The football player have a beautiful accident. What kind of atrophy do you think that he would develop in consequence of what? Well, obviously in the innervation because he have an injury over there, obviously. But remember, if the nerve lose contact with that muscle, you will have an atrophy over there. Clear? That's why in that case, it's because the innervation over there, or because the lack of use. That is the other answer for the same question. But careful with this one too, because it's part of that question. Now, this one is out. I didn't come with this one. Now, hypertrophy, of course, I need to ask you for this. Hypertrophy is a person that is doing a beautiful working out. I have a picture of Arnold Schwarzenegger that you will see soon, and that I put it over there. A person that have a huge physique, a huge definition. Now, I don't want to scare you. Some of you that like to do workout and keep yourself in the gym, like some Daniels of life, um, and is that everybody want to have a strong muscle, and they will do it to do a lot of workout to keep that muscle in good definition and in a good strength. The problem is that any workout also will make your heart hypertrophic too. Meaning, different from the other muscles in your body, the heart never rests. And because you are submitting your body in a huge workload, the heart also will respond, growing his muscle size. And that is a hypertrophic of the left ventricle all overall. A person that developed a hypertrophic heart, forget it, he will suffer hypertension for the rest of his life. And that's it, the beginning of things, like I like to say. Okay? But right now, that definition is coming. Good for you, but careful with cholesterol. Now, let's go over there. Let's go over there with this definition. You need to understand the definition because it's coming in 2 of 4 quizzes. Another definition that is coming is this one. You know, hyperplasia, careful with that definition, is coming. I will put a picture also to help you out to identify if I hyperplasia, hypertrophy, so on, so on, so on. Meaning, careful with that one. Increase in functional capacity related and increase in cell number because the mitotic division is very when you see, I will go back to hypertrophy, but here is increase in cell mass that increase in functional capacity because physiologic and pathophysiologic demand could be because of the workout or because of a disease. Careful with that definition because the person tend to confuse them. I can subtract that definition. So VIP, I would say 3 or 4, we see that question. The other question that you also see is this one. Metaplasia, 204. Careful with the definitions. Replacement of one different cell type with another. I can put, and this is very similar to dysplasia. That is an old question, meaning with this one, but it's different because I will show you dysplasia right now. Dysplasia, the hint is that it's abnormal. If you have the word abnormal, you already know that you have dysplasia in front of you. If I don't put abnormal, if I put another definition, or I can call, for example, metaplasia. Metaplasia is not a normality, meaning you need to be extremely careful because they are very similar. Now, everybody like a freebie, and because believe it or not, I am so proud that I have 56 persons, 110 with me tonight. I will show you the following slide that all of them are probable questions in your quiz next week. I will have a question regarding this. I have a question regarding this. I have a question regarding this. I have a question regarding this, and this fellow, and this fellow. Amazing to tell that every time that I put this fellow, they say that the guy is atrophic. I don't know where is the atrophic over there. But I know the reason, because for so long before me, the previous professor put atrophy as an answer to that question, meaning that every time that they ask you for atrophy, need to be that. I decided to change the picture for this fellow, and they still call this one atrophic person. Good for you. See, you think that that person is atrophic. Yes, I will go back, no problem. Dysplasia? Careful with that definition. Very important indeed. I will ask this one. And I go a little bit further. See, replacement for one cell different type. I don't see abnormality. Meaning, what will be a good exercise tonight? You will go now to this particular slide and start to put the definition that I showed you in the previous one. Make sure that you correlate those pictures with the definition that I show you. That is a way of practice because I promise you, you will see it in the quiz. I promise you. You will see. You will see. You will see. Moving on over there. Finally, the next topic is the necrosis. I need to ask you about necrosis. That is very important. Imagine that it's very important that this is something that all will follow and anybody that is diabetic. Meaning necrosis, necrosis. That definition is coming. Now, exactly. We will enter over there soon. You have 4 types of necrosis. Coagulative, liquefactive. Oh, yes. You don't have any idea what you said. Careful. But guess what? Not only that, I will put pictures of every necrosis. Meaning you need to identify which necrosis it is in the picture. Don't worry, I have another slide over here where I will put them in your quizzes. Of course, they are good quality. That is the good thing about West Coast. We have a good printer. Now, let's go over there. Because those definitions, you need to know them. Could be one with true or false, could be one multiple choice, but they are related to the picture. You have the first two, and the next one, the other two. These also, they have pictures over there. What I did, to be honest to all of you that are listening to me right now, I did this picture as a bonus, meaning that every picture that you identify correctly, is this fat necrosis, is this caseous necrosis, is 2 points extra. Besides of the 6 points for watching the videos. My God, I feel like a Santa Claus after Christmas. Okay, moving on over here. Okay, Careful with those two necroses, death of adipose tissue, and caseous necrosis. Very important like that. Good for you. Now, many people have problem identify which necrosis it is from the other one. But, 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 this one is very characteristic because first of all, it's long and he look like a clumpy cheese. Meaning, at least that one can be ruled out very quickly. Many people have problems with the fat, liquefactive, and coagulative, but this one in particular is it's long. You need to know immediately. No, that is caseous necrosis. Need to be because look like a cheese. I will show you that one soon. Now I will jump over here. Careful with these definitions too. BIP those definition, and we have the famous gangrene. Gangrene. Prepare yourself. Don't ask for that, Daniel. Gangrene, cellular death in large areas of the tissue result from the interruption of the blood supply to a particular body area of the body, or dry gangrene. Careful with this definition. Somebody will see through a fall, exactly, because diabetics always suffer this. 1 of 4, somebody will see dry gangrene. Other person we will see wet gangrene, and the others gangrene. This one in particular, I have an experience with one particular patient of mine, and believe me, I never saw so many putrefaction in a human being. The ulcer with gangrene reached to a point that the entire head of the femur was exposed to that particular person. The reason why the person didn't feel a lot of pain is because he suffered on a paralysis from the spine below, but was something gross. The smell was felt almost, I would say, until 7 room from the area who the guy was basically staying. An interesting experience. Meaning, careful with this one because most of them are I would say, public enemy of the basically diabetic patient. Now, this is the slides that you need to know for your beautiful quiz. Okay? Careful with this one. What is this? You can tell me what organ is that one? Anybody have an idea? Well, good. Wow, I can be. Of course not. That is a kidney. Thank you, Motley. Thank you. Thank you. It's a kidney, for Christ's sake. But the liver, good for you. No. You have over there the lung. See over here that look like a cheese. You have fat over there. And this is a piece of brain over there, liquefactive. And the coagulative over there in the kidney. The heart create these kinds of necrosis too. Okay, coagulative. Pancreas, this one, the brain, this one, and the lung that you have it over there. If you memorize those 4 pictures over there, you will have 2 extra points in your quiz because I will put it as a bonus. All those pictures over there, not all of them. Every test will have 1 picture. Moving on immediately to apoptosis. Apoptosis, and believe it or not, we already have in the half of the chapter number 4, in the chapter. Each question is 1 point. Okay? Not well. 1 question, 1 point, but in reality, is 60 point the value of the quiz. If you have 30 questions, multiply by 2, 60. 2 points to be exactly. Okay? Apoptosis, very important. That definition is a multiple choice. Careful with that. I will ask this one. Careful with this one. 2 of 4 person will see that one. The signals, I will not go with this. I will not go with this because I need to explain something later on. But I can go with this one. I like my P53. There is a multiple choice with the P53 over there, meaning 2 or 4, we see that multiple choice. Many people don't know this, but everybody have a gene that is capable to mutate and become a cancer. Obviously, we have another set of genes that protect our bodies, that gene that promote cancer down. The problem is that the gene that is, I would say, the police one, to avoid that the bad gene became active, also have a mutation. Obviously, you know what happened next. The gene that always will create the cell cancerous will have all the reign and basically multiply without control. The cancer cells are known to be immortal. The only thing that they do is to multiply. That's what they do. Okay? Meaning, careful with this one. The next one, you will see it in one particular test, one of four. I did this one a little bit different to switch between you guys. Okay? It's a multiple choice, and there is a true or false in the other. Now, irreversible cellular damage, the type of necrosis depending on the tissue, you see over here. That's why I put those pictures over there. Basically, it's very similar to what we saw in the picture, meaning that I will not ask you for this. Uh, we saw this one already. I will not go with this. But the irreversible cellular damage, careful with these definitions, are true or false in 204. The next slide is something that will hunting you out until the end of times. This is something that I will ask you now in the midterm, in the final, in the other chapters, meaning that careful with ischemia and hypoxic injury. And you ask me why this is important, exactly because it's most often caused, those tissue hypoxia is often caused by power failure in the cell, basically. But that's what create the power failure in the cell. And so you see the second topic is the most common cause of cell injury. If the cell don't receive that oxygen and go to anaerobic condition, the pH start to decrease and damage those enzymes that produce the ATP, and the game is over. Okay? That's why this slide is very essential for you. You will see it in the true or false and multiple choice. I would say 3 or 4 we see this question, but you will see this question several times between the midterm and the final. And go directly to ischemia. Careful with the first part, true or false. 2 or 4. Careful with this one too. I have a question about the calcium overload in multiple choice. Yes, this one in particular and the previous one, yes, is coming. Don't worry about the the midterm. It's just 50 questions. I promise you that I will give you some reviews over there. But you will see that I will try some of the things that for level I like to emphasize to make you to survive term, okay? Don't cry, Jose, don't cry. You can damage the online session. Bueno, multiple choice with this one. Now, the nutritional injury, I will not go with this because we need to see a chapter about diet, all the nutrients that the person need to follow. This is important topic, obviously. But again, I can do only 30 questions. I need to go with some basic first, meaning that this one is out. You see over here, nutritional injury, the lack of nutrients can create a huge mess in that patient. I will not ask you this one. I will not ask you this one either. We will see this one later. The same thing happens with this. This is interesting because we will talk about this one later, that BMI, and believe it or not, there is a huge fight behind doors in regarding that. Infectious and immunological injury, bacteria and viruses can injure the cell, yes, in variety of ways depending the virulence. You already have a little bit of experience about what is happening, but again, I will not go with this one right now. Chemical injury, toxic chemical over there, I will not go with this, but I would like to go with these factors. Careful with these factors, somebody will see a question, multiple choice. One of four, somebody will see that one. As you see over there, we are reaching almost the end of the third chapter. We're going from the last one of the night. Then we have cellular aging. Believe it or not, this is a topic that will take almost 2 weeks to explain. And what's basically what you have over there is just a brush out about how the cell became older. Obviously, a lot of exposition to environmental factor can damage that DNA, that information cell possess. And when the cell start to fabricate and produce those protein, will be defective protein that will increase the damage to the cell itself. Right now, we will discuss that one later. I will not go with that one, and I will not go with that one either. We have several theories how the person became older. Many people, I think Gaston mentioned the telomeres over there. That is true. A telomere is a beautiful cap that the chromosome possess in the extreme. And they say that more bigger and wider that cap in the chromosome is, more time to live you have, thinner became that cap in the chromosome. Well, less division that cell possess, and probably you are reaching the end of your life. But this is the kinds of thing that we are seeing over there. But I will this one right now. Physiologic changes of aging also is out, but I want to ask you the somatic death. Somatic death is a multiple choice and include the next slide, that is the last of the chapter, meaning multiple choice, death of the entire organism, no inflammation or immunologic response happen prior to your death, general features, cessation of respiration, so beat, and then the next one, presence of the stiffened muscle throughout body, that we call rigor mortis, release of the lytic enzymes of the body tissues, postmortem autolysis, and determinations of brain death as a proof of somatic death. I want to emphasize this. Exactly. I want to emphasize this, very important. The person, to declare a person's death, me as a physician, and believe me, I already signed a lot of death certificate in my life, like a telephone book. For me to declare a person dead, you need to have. If I ask you a question in the midterm or in another quiz, what is the criteria to declare a person dead? Don't tell me that a person is because stop breathing or because no pulse. The legal criteria to declare a person dead, you have it over there. It's the only one. I don't care that your heart is pumping, because you don't have cerebral activity, you are dead in the legal criteria. Very important that to remember, meaning between those two slides, you have a multiple choice. I create one and everybody, almost everybody will see that particular question that is multiple choice. And believe it or not, chapter 4 is gone and we are going for the final chapter of the night. Yay!